Let's simplify this heated debate about Tylenol, acetaminophen, pregnancy, autism, and more, as if we're chatting over coffee, no complications. On September 22nd, 2025, President Trump dropped a bombshell at the White House, alongside Health Secretary Robert F. Kennedy Jr. and CMS Administrator Dr. Mehmet Oz. Trump was blunt. Tylenol is not good. Don't take it. Warning that the drug during pregnancy may be linked to a significantly increased risk of autism. He cited a connection found between the painkiller and autism in children, known by its brand name Tylenol, and even claimed there are no cases in the Amish community or Cuba, where acetaminophen is supposedly rare. Kennedy backed him up, stating that 40 to 60% of mothers of autistic children blame vaccines, a myth he promised to investigate, despite years of promoting debunked theories. The FDA's immediate announcement: doctors must be notified of risks, and pregnant women should avoid the drug early in pregnancy unless they have a high fever with no better alternatives. Trump insisted there's no downside to not taking it, and suggested using it only for very high fevers if you can't handle it. They also promoted linoleic acid as a supplement to reduce autism symptoms. But what about the science? It's not so simple. Acetaminophen is the safest painkiller for pregnant women, used by over 50% of them globally, recommended by ACOG for pain or fevers. Recent studies, like an August 2025 Mount Sinai analysis reviewing 46 studies, show a potential, not causal, association with autism or ADHD, a 20 to 30% higher relative risk with prolonged use, especially late in pregnancy. But a 2024 Danish study with 2 million children found no increase for autism, and Yale, September 2025, suggests the underlying fever or infection may be the culprit, not the drug. Absolute risk? Low. From 1 to 2% to 1.2%. The real danger is high fever, greater than 101.3 degrees Fahrenheit, in the first trimester, which doubles the odds of neural defects like spina bifida and may be linked to autism. Don't ignore fever. That harms the fetus more. The FDA updated labels in 2025 to warn against overuse, but ACOG and SMFM reaffirm. Benefits outweigh risks. Use low doses, short duration. Alternatives? Rest, hydration, cold compresses. Avoid ibuprofen after 20 weeks. On vaccines, Trump and Kennedy revived the myth, but the science is clear: zero link to autism. A 2025 JAMA study of millions of children confirms vaccinated and unvaccinated have equal rates. The rumors stem from a 1998 fraud. Autism is 80% genetic plus environmental, parental age, infections. Vaccines prevent measles, which causes deadly fevers in pregnancy. Ignoring them is an unnecessary risk. And the Amish? Trump claimed zero autism without Tylenol or vaccines, but a 2010 study found 1 in 271 cases, lower than 1 in 36 in the U.S., due to underdiagnosis or isolated genetics. 85 to 98% vaccinate. Adjusted rates are similar. It's not proof, it's cultural bias. Trump's announcement highlights valid caution, but exaggerates, ignoring balanced FDA and expert evidence. Focus on the essentials. Consult a doctor, monitor fevers, vaccinate, take folic acid for 100 micrograms per day. Autism diagnoses have risen due to better detection, not an epidemic. For seniors, Tylenol remains safe for chronic pain like arthritis or mild fevers, safer than ibuprofen, which risks gastric or kidney bleeding. But beware, aging livers process slowly. A 2025 Journal of Gerontology study warns doses 3g/day raise liver toxicity risk by 15%, worse with alcohol or fasting. Mayo Clinic and FDA. Max 3-4g/day, adjusted 2-3g for frail seniors, lowest effective dose, short duration. Extra risks: GI, cardiovascular, kidney with repeated use. Consult a doctor for interactions, e.g. with statins. 75% of those over 65 have chronic pain, but education saves lives. Breathe. In moderation, it's an ally.